Hello, my name is Dr. RedAux, and today we're going to raise some lupus awareness for our GOTEL stream team here in the Pixel Pond. Let's begin with a quick discussion of the normal immune response. Normally, our B cell function under healthy conditions support our immune system by recognizing foreign antigens and differentiating into both plasma cells and memory cells. B cells produce antibodies to fight infection, and they work alongside T helper cells to coordinate the immune response. However, in lupus, B lymphocytes, aka B cells, develop cellular dysfunction, and their role in the immune system is broken. Normally, B cells help protect our body by producing these antibodies against pathogens and protect us from bacteria, viruses, and other invading organisms. However, in lupus, B cells become dysregulated and begin to attack our body's own tissues. Normally, our immune system eliminates or suppresses dysfunctional B cells that react against our self, or ones that create what we call self-antigens. This process is called immune tolerance, but in SLE, aka lupus, this protective mechanism fails. The B cells begin to recognize the body's own nuclear material as foreign. Some of these elements of our body include DNA, RNA, and nuclear proteins, and instead of recognizing these substances, B cells produce autoantibodies against them. The hallmark of lupus is an excessive production of these autoantibodies. Activated B cells transform into plasma cells which continuously secrete autoantibodies. This causes chronic immune activation, persistent inflammation, and injury at the tissue and cellular level. Unlike normal immune responses, this inflammatory process doesn't automatically shut off, it continues unchecked. Because autoantibodies can bind to self-antigens and circulate through our bloodstream, they create immune complexes which can then deposit in tissues all over the body. This includes the kidneys, our skin system, blood vessels, joints, and more. And once they're deposited, they activate a complement and inflammatory pathways. This results in tissue destruction at the cellular, tissue, organ, and even system level. Lupus is one of the most challenging autoimmune diseases to manage because it's highly variable, unpredictable, multisystemic, and immunologically complex. Unlike diseases that affect a single organ or follow a consistent pattern, lupus behaves differently from patient to patient and even changes over time within the same patient. Lupus can affect nearly any organ in the body system. And while one patient may experience only mild joint pain and rash, others may experience kidney failure, stroke, seizures, and severe vasculitis. This variable means treatment can't follow a simple one-size-fits-all approach. Most lupus medications suppress the immune system, and while these reduce inflammation, they also impair the body's ability to fight infection, which creates a difficult balance for treatment. With too little suppression, you end up with ongoing organ damage from the disease, and with too much, you end up with severe infection. Additionally, fatigue in lupus can be profound and persistent. Some of those contributing factors include chronic pain, inflammation, sleep disturbances, depression, the effects of medication, and psychological stress, which also worsens the disease over time. Patients with lupus often struggle with maintaining employment, having steady relationships, financial burden, anxiety and depression, and other long-term complicated issues. Today, there is no cure for lupus, but there are many therapies used to control the disease activity, reduce flares, slow organ damage, and disease progression. But none of these treatments eliminate the underlying autoimmune dysfunction. Therefore, lupus treatment and management requires lifelong monitoring and medication, as well as ongoing interdisciplinary care. These new therapies that are coming out today are both wonderful and very expensive, many of them with varying responses in our new patient population. And that's why the work of our friends Stream Team here and GOTEL is so important. So let's raise some money, raise some awareness, and find a cure for lupus.